Minister, South Africa has been talking about producing its own vaccines since we saw the advent of COVID-19. Just where are the discussions? How far are we?
Well, we've made a lot of progress since the dark times of COVID-19. For instance, the president at the time, as he was asked by the AU to be the champion in acquisition of vaccines for the continent, also then instructed us as the department, myself in particular, Department of Science, Technology and Innovation, that we must pull together our scientists. And he is convinced that our scientists can be able to produce our own vaccines. In fact, we have. The first is that we have now produced a suite of vaccines, a few, one dealing with malaria, the other one dealing with coronavirus-related diseases, pandemics, if you like. And then the latest one is the one produced by our company, which is partly state-owned, which is Biovac, which is a cholera vaccine. And the first of its type is oral. It's taken orally rather than by injection, which makes a big difference, and we hope that this actually now is just seeing South Africa really and truly taken off. We are not doing this for South Africa only. We are doing this for the African continent, Just now we were meeting with our partners. There is the Gavi, which is the supplier of vaccines mainly to developing countries. The chairperson of Gavi, we're meeting with him, is the former Prime Minister of Portugal, amongst other things. As well as we're meeting with the German ambassador and the German development agency called GIZ, just discussing a way forward to take these things further with their support, which we actually appreciate, vaccine development in the African continent, and committing, to work, that they want to work together with South Africa, and they see South Africa as one of a few countries maybe in the continent that has got the capacity and then needs to be strengthened to play this leading role in producing vaccines for the African continent. We also, by the way, have got our own commitment as the African continent that by 2040 we would like to see 60% of the vaccines needed in our continent being produced here, other than what has been the situation in the recent past where 100% of vaccines needed in the African continent are produced in Europe or the Americas, which is not a very helpful arrangement. So that is the story.
You spoke about the funding, and I would also speak about the speciality. Does Africa have the speciality and the funding to be able to produce their own vaccines?
Well, that is why this alliance on vaccine called Gavi is very important, because they provide very necessary resources to support the initiatives that we are doing. We are also working with the World Health Organization, able to get some minimal support there, but which is not insignificant. And we are, by the way, looking at the continent as a whole. We have got our own small resources as the Department of Science, Technology and Innovation. That's what we have used to set up the Vaccine Innovation Manufacturing Strategy, VIMS, which derives directly from that instruction from the President. Of course, the issue of resources is a complicated one, especially in our continent, because given the numbers, a continent of 1.8 billion people and 52 or 54 governments, we have a huge market. But it's only potential at the moment, because if you can have our governments committing, for instance, to buy vaccines that we produce locally, we've got more than enough money. If our Department of Health throughout the African continent are able to actually commit to that vaccines that we produce, they are going to acquire them. that can really change the situation quite dramatically. We hope we'll get there at some stage. That is why what we are emphasizing also is the need for the African continent to work together.
All right. Lastly, perhaps, Minister, the G20 countries are meeting, often referred to as the rich countries. What would you be your call to them?
Well, one of the main things that we've been working on in the lead up to the Leaders Summit this coming weekend is actually in the whole area of vaccine production, especially building capacity for the African continent to produce its own vaccines. Our message is to say our true friends must support the research agenda and the vaccine agenda of the African continent rather than the African continent sometimes being used by donors who are interested less in African development, but also in using Africa as a place for clinical trials and other things, but for the benefit of the rest of the world. We want to say now the message we are sending across during this G20 is that with adequate support, we have the capacity to be able to produce vaccines, and that vaccine development, in the light of the fact that the world is still going to see more pandemics. COVID-19 is not the last one. So it's very important that as part of our own pandemic preparedness, we are then able to develop our own vaccines. I must say that we've generally been having positive support from most, overwhelmingly, the number of G20 countries that we've been working with already. And we hope that that aspect will actually be adopted as part of the declaration from the Leaders Summit this coming